This is my dad, Keith. One day, my dad went to his primary care physician for a regular checkup. During the checkup, a digital rectal examination was performed that revealed that my dad had an enlarged prostate. The doctor ordered for blood work to be done to check his PSA, prostate-specific antigen levels. My dad's blood screening results came back that his PSA levels were elevated at 9, 10, and 11 nanograms per milliliter on 3 separate occasions. Normal PSA levels are less than 4 nanograms per milliliter. Because my dad had elevated PSA levels, there was a 1 in 4 chance that he could have prostate cancer, so the doctor ordered for a biopsy to be done. His biopsy results revealed that of the 12 samples, 1 came back positive for a small focus of prostatic adenocarcinoma in the right mid-lateral part of his prostate. On October 13, 2015, my dad was diagnosed with prostate cancer. Adenocarcinoma is the most common type of prostate cancer and develops in the gland cells. According to the American Cancer Society, prostate cancer is the most common cancer in American men. In 2017, there was an estimation that there will be about 161,360 new cases of prostate cancer in the United States. Although prostate cancer can be detected early, some men may still exhibit symptoms before they are diagnosed. These include problems urinating or having slow or weak stream when urinating, nocturia, frequent urination at night, hematuria, presence of blood in urine, and erectile dysfunction. It is recommended that men start having prostate examinations starting at the age of 40. During a prostate examination, a doctor will perform a DRE, a digital rectal exam, and also order for blood work to be done to measure PSA levels. If during a prostate exam the doctor finds that you have an enlarged or lumpy prostate, the doctor will order a series of different cancer screening tests to determine if a man has prostate cancer. These tests include blood tests to check for elevated PSA levels, imaging tests that look at the whole body to determine where the cancer is, the size, and if it has metastasized. Imaging tests include CAT scans, MRIs, transrectal ultrasounds, and bone scans. And the last screening test is a biopsy test, where several tissue exams of the prostate are taken and examined under a microscope. A biopsy can also reveal the Gleason score. The Gleason score is an important number that grades prostate cancer. The number can range from 2 to 10. The Gleason score number depends on how similar or different the cancer tissue looks compared to normal prostate tissue, with grade 2 meaning that the tissue looks a lot like normal prostate tissue, and 10 meaning it is very abnormal looking. Because the prostate can have different grades, the Gleason score is added where the cancer is most abundant in 2 areas of the prostate. The 2 grades are then added and called the Gleason sum to make up the Gleason score. Once the Gleason score has been determined, the doctor then uses this score to determine the appropriate treatment for the cancer. Treatments for prostate cancer can vary depending on how severe the cancer is. For less aggressive cancer, the doctor will offer for the patient to wait and keep a watchful eye by having doctor's appointments every 6 months to check for PSA levels. If a patient decides they want to go forward with treatment, the doctor will suggest different types of treatment that include radiation therapy, hormone therapy, chemotherapy, vaccine treatment, surgery, cryotherapy, and bone direct treatment. Because my dad's Gleason score was a 6, he decided to go with radiation therapy as his treatment. Pinpoint radiation therapy was used to target the radiation to just his prostate. During the course of 3 months, my dad went to therapy 5 times a week, Monday through Friday, with sessions lasting 20 minutes each. After each session, he was still able to go to work as normal. On January 15, 2016, we found out that all cancer cells had been killed and he was in remission with still elevated PSA levels. Now in 2017, my dad is in complete remission and his PSA level is now at a 2.6. The 5-year survival rate for prostate cancer is almost 100% and my dad is living proof.